Hello coders! Welcome to Fast Coder 21 free medical coding YouTube channel. As all of us know, every year we need to follow CMS latest ICD-10 CM guidelines. Usually we need to start using ICD-10 CM guidelines from every year October 1st. So this year also CMS published 2024 updates. In this session, we are going to learn comparison of ICD-10 CM 2023 guidelines with ICD-10 CM 2024 guidelines. If you want to code ICD-10 CM codes properly and perfectly, you need to watch this video until the end to gain in-depth knowledge about changes and also need to know new codes. In the current screen, we have left side financial year 2023 updated April 1, 2023 guidelines which are applicable until October 1st, 2020 September 30, 2023, and we have right side financial year 2024 updated October 1st, 2023. So we need to use these guidelines from October 1st, 2023, and we can use these latest 2024 guidelines until September 30, 2024. So here we need to understand. So here April is in the pink color. Here October is in the green color. So all the changes will appear in pink color in older version like 2023 and green version in 2024 version of ICD-10 CM guidelines. So in this session, I am showing only the changes which were changed by the CMS in order to save time. If you see in this page, we have only changes in the headings of the guidelines. So there are no changes here in the documentation. So wherever there is no changes, I will skip that and I will go wherever there was a change. So basically, there are no changes in the index of the guidelines. So you need to understand that wherever there is no change, I am going and I am skipping that page. So here we have one change. If you check here, code G20 represents the underlying etiology Parkinson disease in 2023. In 2024, the CMS has changed the description. If you see here, a code from category G20 is listed first, followed by code F02.80 or F02.81 in brackets. And also a code from category G20 represents the. Basically here CMS has revised the description of the guideline. If you see here, there is a small word attending is added here. Attending provider should be queried, but to here there is no word of attending. In 2024, we have social determinants of health SDOH classified to chapter 21, which is not mentioned in the 2023. And also here CMS has deleted the word attending and directly they have mentioned the patient's provider. So here in 2024, CMS has added one guideline related to HIV. We will read that HIV guideline now. So which is IJ encounter for HIV prophylaxis measures, which is not in 2023 guidelines. So when a patient is seen for administration of pre-exposure prophylaxis medication for HIV, assign code J29.81 encounter for HIV pre-exposure prophylaxis. So pre-exposure prophylaxis is intended to prevent infection in people who are risk for setting or getting HIV through sex or injection drug use. Any risk factors for HIV should be also coded. So which this guideline is not present in 2023, but we need to use this guideline from October 1st, 2023. So here basically whenever the patient presents for administration of pre-exposure prophylaxis medication for HIV, we need to use J29.81. So basically, prophylaxis measures will be used for the patients who are at the risk of developing the disease. Like in our situation, based on this guideline, HIV. So in order to prevent HIV disease, patient needs to take pre-prophylaxis HIV medication. So October 1st, 2024 onwards, we need to use J29.81 if the patient presents for pre-prophylaxis medication of HIV. So here in sepsis guideline also, CMS has changed its description. So sepsis guideline, sepsis due to a post-procedural infection. So for sepsis following a post-procedural wound, example surgical site infection, a code from T81.41 to T81.4, infection following a procedure, or a code from 086002 to 08603, infection of obstetrical surgical wound. The this identifies the site of the infection should be sequenced first. So as I told you previously, so whenever there is a change, we will check that change. Otherwise, I will skip remaining pages. So here in COVID guidelines section, we have F, screening for COVID-19 has completely minimized. So for screening for COVID-19, including pre-operative testing, we need to assign the code J11.52 encounter for screening for COVID-19. As COVID is subsided now, CMS has changed its COVID guidelines and they have mentioned only J11.52 for COVID screening. So here also in neoplasm guidelines, we have previously CMS mentioned solely, but they have changed solely to chiefly for the administration of chemotherapy. So previously, if you see here, we have one addition of one word, diffuse large. So in 2023 guidelines, we have there is no word metastasis of B cell lymphoma, but here they have added metastasis of diffuse large B cell in 2024. So in circulatory system guidelines, CMS has added 12th point here, hypertension resistant, which is not present in 2023. So what is hypertension resistant? So resistant hypertension refers to blood pressure of a patient with hypertension that remains above a goal in spite of the use of antihypertensive medications. So assign code I1A.0 resistant hypertension as an additional code when apparent treatment resistant hypertension or true resistant hypertension is documented by the provider. A code for the specific type of existing hypertension is sequenced first if known. So basically this guideline states that so if the patient has hypertension in spite of using drugs or medications, we will call it as hypertension resistant. So in order to code hypertension resistant code, physician needs to mention in the documentation as which will be needed to documented by the physician in order to code I1A.0, which is the new guideline from October 1st, 2023 we need to use. So here in myocardial infraction guidelines also changed and the CMS has added one guideline here, myocardial infarction with coronary microvascular dysfunction. So coronary microvascular dysfunction CMD is a condition So as I have mentioned previously, where there is a change, we are learning from that section. So if there is no change, I am skipping those pages. So here one change in 2024 related to comma. So we learn comma. So code R40.20 unspecified comma should be assigned when the underlying cause of the comma is not known, or the cause is traumatic brain injury and the comma scale is not determined in the medical record. So whenever there is no underlying cause for the comma, we need to use R40.20 unspecified comma. And also we have some guideline change. So the comma scale codes can be used in conjunction with traumatic brain injury codes. Okay, these codes cannot be used with code R40.2a non-traumatic comma due to underlying condition. So basically, we need to use these comma scale codes R40.212, R40.24 along with the traumatic brain injury codes. So we can't use these codes along with the non-traumatic chroma. So here also there are no changes. So I am skipping. Wherever there is a change, I am stopping there. So whenever you see green color on the right side, we need to think that there is a change. So here we have one guideline change. For sequela late effect, see section IB10. So in toxic effects section, we have few guideline change. So when a harmful substance is ingested or comes in contact with a person, this is classified as a toxic effect. Okay, the toxic effect codes are in categories T51 to T65. So when coding a toxic effect, assign the toxic effect code first, followed by codes for all associated manifestation that toxic effect. So whenever we patient has the reaction due to toxic effect, we need to code toxic effect code first, followed by the all associated manifestation because of the toxic effect. So now we are at chapter 21. Here there are no changes. So because of that reason, I am skipping these pages. So in 2023 October, we need to use these codes, and CMS has added one history code, which is personal history of military service. So if the patient is military service, worked in the military service, we need to use JET 91.85. So here in the follow-up section also, we have one guideline. So course JET08 encounter for follow-up examination after completed treatment of malignant neoplasm, and JET09 encounter for follow-up examination after completed treatment for conditions other than malignant neoplasm may be assigned following any type of completed treatment modality, including both medical and surgical treatments. So here, irrespective of modality of the treatment, we need to code JET08 as well as JET09, whether it is medical process or it is surgical intervention. We need to code JET08 and JET09. And G line section, CMS has added JET91.A caregivers non-compliance with patient's medical treatment and regimen. So if the caregiver is unable to cope up with the patient, we need to use JET91.A, and we need one more character. Thank you guys. So basically there are no much changes from 2023 to 2024 guidelines. Only few changes we need to remember. Those are new changes. So if you like this session, please click on like button and share this video to your friends. Please don't forget to click on like button in order to motivate us.